Thanks, Ron. Well, if you're over 40, you might want to hear what our next guests have to say about bioidentical hormone replacement. We're talking about regaining youth and energy and getting rid of grumpy and unmotivated moods and start living your life again. Now, with me this morning is George Thompson. He's from Total Med Solutions, and he brought along with him patient Garland Kearns. He's here to talk about his experience with bioidentical hormone therapy and how it improved his life. Gentlemen, good morning to you.
Morning.
George, let's start with you and talk about bioidentical hormone replacement. Why do we need this?
And once you reach the age of 30, your testosterone levels start to decrease by 1 to 5% a year, and they continue every year thereafter.
Okay.
So we use a bioidentical hormone, which is a plant-based, it's actually soy-based, to increase your testosterone levels, because so many patients end up with just a rundown feeling. So this gives you a ton of energy, helps you sleep better at night, more mental focus, more clarity.
Yeah.
You feel 20 years younger.
Okay, sounds good to me. And Garland, you're here to attest to that. You're a local firefighter who has been going under treatment. So since you started over at Total Med Solutions, what changes have you seen since starting testosterone therapy?
A lot more energy. I'm not a couch potato anymore. I can get out and do things. I don't feel just blah all the time. And like I say, just have a lot more energy and a lot more get up and go.
Okay, and you're a local firefighter, so I would think you have strenuous jobs at times. So has this improved your work performance?
It's helped a lot with the endurance. I can stay in the fire longer, stay with my crew longer. We can, do our job longer and not leave it to another crew to have to come in and finish our work for us.
All right, that's great. So you're obviously really happy. Let's talk about your wife, because sometimes the partners in our lives have firsthand information on the improvements of our spouses. So what does she say since you've started therapy?
She says it's like when we first met. Like I'm 15, 20 years younger. We do more stuff together in the house, out of the house. Like I say, just gives me more energy, and she's more happy with my performance and everything now, so we're doing good there also.
All right, Garland, that's good to know. Okay, let's go back to you, George. I want to talk about, this story. Is this typical of what you're hearing from people who start therapy with you?
It really is. We see these types of stories every single day at our clinics. But it's more than just that. 2 months ago, we had a husband and wife come in. He wanted to get started on testosterone therapy, so we ran his testosterone levels along with the PSA, which tests for prostate cancer.
Oh.
The levels came up to the high end of the range, so our nurse practitioner sent him to a urologist. Well, 3 weeks later, his wife came to our clinic. She came in for Botox and wrestling treatments, but she pulled me aside and said, "Listen, I want to tell you that when your nurse practitioner sent my husband to the urologist, they ran a biopsy, came back positive, so he had prostate cancer."
Wow.
And she said they caught it early enough that he was able to be treated and he had full recovery. But she said, "Here's the deal: he's 41 years old, and he wasn't going to have a prostate cancer check until he was at least 50. The doctor told her he wouldn't have ever made it."
Wow.
So it's this Sunday is Father's Day. So what we want to do for husbands, fathers, boyfriends, whatever the case may be, any patient that comes in for a testosterone check, we're going to give you a free PSA test, because we want to make sure that if this is something that you have, we want to get treated early and save your life.
Wow, that must make you feel really good that you ran that test and that you saved that young man's life at age 41.
Yeah, she was pretty happy.
She was pretty happy, I'm
sure.
sure.
So here's what we're doing. We're going to go ahead and if you go to totalmedsolutions.com
Okay.
/GMT, we've got a $50 gift certificate that you'll receive, and you can use that for any of the 25 products and services that we offer.
That's fantastic, and you can get that free testing done as well between now and Father's Day. Garland, final thought for you. Anyone who's watching who might be a little apprehensive, what would you say?
Yeah, don't sit around. I was wondering, I just thought, hey, I'm getting older, I'm going to have no energy, and this is just going to be the rest of my life, and that's not it. And now hearing this story, especially, they saved somebody's life with this test, so
Sure.
It doesn't hurt to go in and get checked and just find out and see what your options are, if nothing else.
Great, Garland. Thank you for being here and sharing your
Thank
story.
you.
And George, always good to see you. All right, you've heard all of that. All GMT viewers will go to totalmedsolutions.com /GMT. You fill out the questionnaire, and you can also get that great offer that George mentioned. Here's the number to call, 214-987-9200. Carrie, over to you.